Hello, my name is Jennifer Reyes. This video is for Nursing 1410, Leading in Interprofessional Practice. The video will discuss the following. An incident that occurred while working as a registered nurse from personal experience at a long-term care home. Discuss how ineffective teamwork led to ineffective resource management to include human and financial resources. Reflect on collaboration and discuss ways to improve to better outcomes. Discuss multidisciplinary teamwork techniques that support staff in improving their performance and collaborating efficiently, and also reflect on how disciplinary teams can carry out goals set forth with change management ideas. My experience with collaboration with a multidisciplinary team. This experience will be shared as one of a patient who lived in a long-term care facility that I cared for as a registered nurse. The patient was bedbound, nonverbal, and had lower extremity contractions. I was off for 3 days and came back to find 2 open wounds. I immediately called the physician to let her know of the skin changes to receive orders to start treatments. With the director of nursing aware of the situation, this ensured that the orders provided were updated. MDS updated the care plan and the dietitian implemented an order to increase the feeding tube rate. She also included vitamins such as zinc, vitamin C, and Prostat liquid until the wounds were healed. Having a partner who is aware of the various phases of wound healing and differing dietary requirements at each stage is critical to managing wounds. This is an article per Galley 2021. I also had inquired about a referral to wound care. The facility contracted with a wound care physician who would round weekly. Having him on the care plan could help the wounds from progressing. We considered the patient's bedbound status and other comorbidities that could cause further breakdown. As we all know, if a pressure sore progresses, they are harder to treat. According to the article from the NIHL, having a multidisciplinary team will ensure that the care is patient-centered and that it has better outcomes. Per McLeany, 2022, ineffective teamwork and the cost. Staffing issues could have played a part in the skin breakdown during the week. We may consider nurse fatigue or overlooking the sites of the wounds, also remembering how quickly wounds do develop. Having high turnover rates of nursing staff, decreased familiarity with the patient. Having a high patient load puts more stress on the nurse and things are missed. There are several factors that managers assess to prevent this from occurring again. These wounds alone cause several disciplines to be involved in the care, which cost the insurance company a hefty amount. Honey-based applications were expensive to buy per supply manager based on the current budget. Since the order was daily and included dressings, the cost added up monthly. It was projected that wounds would cost the healthcare system $35 billion, about $110 per person in the U.S. by 2023. Also from an article from McLeany, 2023. So the strategy to improve team's ability to achieve better outcomes. How we carried out this plan of care was to have the physician round on Wednesdays to measure the wound and update the orders as needed. Both were diagnosed as stage 2 wounds. What we did was make sure the patient was repositioned every 2 hours and as needed. A nurse had to sign off that it was completed, along with pillow placement and floating heals. The order was to have the wounds cleaned and dressed every day. We added changing the dressing as needed for loose or soiled dressings. This would help the healing process. Since this was one patient who developed these pressure wounds, they scheduled PRN CNAs to help with showers and rounds. One CNA would come in from 9 a.m. to 2 p.m. and the other would cover 2 to 6 p.m. The night shift received extra help from 6 to 2 to assist with showers and changing. This was a great idea as the other patients were moving around and getting the extra help needed. We also called the family on wound care round days to update them on their loved one's progress. In the article, Innovative Treatment Strategies to Accelerate Wound Healing, they emphasize the importance of preservation of skin integrity to stay healthy. They also say that a delay in healing prevents the restoration of the skin's integrity. This was from an article from Cole and Metal, 2023. This article confirmed from recent research that what we implemented was a good plan of action for this resident. We were keeping the wounds clean and keeping the pressure off as ordered. The multidisciplinary teamwork techniques that improve patient outcomes. During the patient's treatment over 2 months, the wounds resolved. Having different disciplines following the wound's progression and updating orders as needed proved helpful. We also added an order to monitor the site's post healing for reopening. This was added as the patient is at an elevated risk for skin breakdown. Another way we can prevent wounds is by keeping the Braden scale on admission and as scheduled, by completing the Braden scale on admission and as scheduled. This was an article per Kennerly, 2022. Keeping patients dry, fewer layers of linen under the skin, heel elevation, nutrition, and repositioning can be completed by any nursing staff member. These are the basics of keeping a patient from developing a pressure sore. Sometimes they cannot be prevented as certain conditions limit the use of preventative interventions no matter what is ordered, from Edsberg, year 2022. Educating the staff on how fast a wound can present itself was also noted, even if a patient is repositioned and care is planned appropriately. So we're going to reflect on how interdisciplinary teams carry out goals and change management ideas. Within these teams, providers, including myself, we manage this promptly and resolved it without progression of the wounds. Through communication and collaboration, sharing our insights for the patient's benefit, we were able to heal this patient and learn from mistakes. We set a goal that the wounds would improve and that the patient will not have any complications. Sepsis is always a concern with wound healing. The patient never ran a temperature or needed antibiotics for treatment. We adapted and revised as needed. We had tried different treatments. Honey with a dry dressing was the idea that healed these stage 2 wounds. The patient was already on an air pressure mattress, so that was already considered. One treatment that did not prove effective was an application of powder on the peri wound and honey on the wound bed. This order was not working as planned. We notified the physician and the order was stopped. He suggested going back to the honey application, as it provides a constant release of bacteria killers when applied to the wound bed, per Panquel, 2022. Being that pressure sores can be extremely difficult to treat, it is vital that nurses and clinicians collaborate as an interprofessional team. When this occurs, it can deliver the highest quality of care that includes monitoring, treatments, and follow-up care. This was per article from Mondragon, year 2024. Keeping the communication lines open helped us to find treatment that worked. With the other implementations, the wounds resolved and remained closed.